If you're an older adult or care for someone who is, this is something you need to hear. Did you know that some common medications could be hurting your brain health? That's right. Certain drugs known as anticholinergics have been linked to memory loss, confusion, and even an increased risk of dementia. But don't worry, we're going to break it all down so you can make informed choices. Now let's dive into 7 commonly used anticholinergic medications you should be aware of, especially those frequently prescribed in outpatient settings. All these drugs are listed on what we call the Beers list, a record that geriatricians have maintained over the years. This list highlights medications that can be potentially inappropriate for older adults due to their risks, and it's wise for seniors to avoid or use them cautiously. First up are sedating antihistamines, which can easily be found over the counter in pharmacies and grocery stores. The most recognizable one is probably diphenhydramine, known as Benadryl. You might wonder about other antihistamines like loratadine or Claritin. The good news is that non-sedating antihistamines are much less anticholinergic, making them a safer choice for older adults experiencing allergies. So if allergies strike, it's better to opt for a non-sedating antihistamine instead of a sedating one. Next on the list are the PM versions of common over-the-counter pain relievers like Tylenol PM, NyQuil, or Advil PM. The PM indicates that these products contain a mild sedative, which is usually a sedating antihistamine combined with the pain reliever. If you check the ingredients next time you're at the store, you'll likely find diphenhydramine or another sedating antihistamine called doxylamine, both of which are highly anticholinergic. So exercise caution with these medications. There are also over-the-counter sleep aids like Unisom. A quick look at the ingredients will usually show that it contains diphenhydramine or another form of sedating antihistamine, making it anticholinergic. If you're dealing with pain at night, stick with a plain painkiller, and for sleep issues, chat with your doctor about alternatives that don't involve these types of medications. Lastly, let's talk about medications for overactive bladder, which is another category worth noting. Since the parasympathetic nervous system plays a significant role in bladder function, blocking acetylcholine can lead to a relaxed bladder that doesn't contract as frequently or forcefully. These urinary issues are common among older adults, and many have been prescribed bladder relaxants, such as oxybutynin, ditropan, tolterodine, Detrol, or solifenacin, Vesicare. It's important to recognize that many medications out there have anticholinergic properties. This doesn't mean you should completely avoid them, but it's something worth considering. There are often alternative strategies to manage overactive bladder or other urinary symptoms. It's crucial to consult your healthcare provider about these options before committing to long-term use of such medications, especially in individuals experiencing memory issues. Coming in at number 4 on my list of anticholinergic drugs are those used for vertigo, motion sickness, or nausea. A well-known example is meclizine, marketed as Antivert, which is frequently prescribed for benign positional vertigo, a condition that notably affects older adults. This condition can make individuals feel as if they are spinning or that their surroundings are tilting, often due to issues with the inner ear. Historically, meclizine has been the go-to treatment, but it turns out there are specific physical therapy techniques that can effectively address vertigo as well. If an older adult is taking this medication, it's essential to ensure they genuinely have vertigo. Another medication you might have heard of for motion sickness or nausea is dimenhydrinate, known as Dramamine. This too has anticholinergic effects. If you're using it occasionally, that's generally fine, but it's something to keep in mind if you find yourself reaching for it often. Next on my list, at number 5, are medications prescribed for itching. These are usually strong oral antihistamines like diphenhydramine, Benadryl, or hydroxyzine, Vistaril. If you're dealing with itching, it would be wise to discuss with your healthcare provider whether a topical cream might be a better option, as these often have fewer side effects for older individuals. Many older adults experience itching due to dry skin, and simply increasing their use of moisturizers and proper skincare can significantly alleviate this issue. At number 6, we have medications for nerve pain. An older class of antidepressants, known as tricyclic antidepressants, has somewhat fallen out of favor for treating depression because we now have a new generation of antidepressants, particularly the SSRIs, selective serotonin reuptake inhibitors. However, These tricyclics are still sometimes prescribed for nerve pain. Examples include amitriptyline, Elavil, and nortriptyline, Pamelor. These medications were also once thought to help prevent post-shingles nerve pain, known as post-herpetic neuralgia. But current research suggests they might not be very effective in that regard. Ideally, the best way to avoid pain from shingles is to get the shingles vaccine. If you're currently on a tricyclic antidepressant, it's advisable to discuss with your healthcare provider the possibility of alternative treatments for the condition it was prescribed for. Lastly, at number 7, we have muscle relaxants, which are commonly prescribed for back or neck pain, with cyclobenzaprine, Flexeril, being one of the most frequently used. It's vital to understand that cyclobenzaprine is quite anticholinergic, so caution is needed when considering its regular use, especially for older adults. Back pain and neck pain are conditions that can often be managed through various methods. Research doesn't clearly show that cyclobenzaprine offers any significant improvements over other management strategies for back pain. Now let's talk about a specific medication that's a bit of an outlier in the anticholinergic category. This is paroxetine, commonly known by its brand name, Paxil. Paroxetine belongs to the class of SSRI antidepressants or selective serotonin reuptake inhibitors, which are generally used for treating both depression and anxiety. While most SSRIs do not have anticholinergic properties, Paxil does, which is why it's rarely prescribed in geriatrics for these issues. This wraps up my overview of commonly used anticholinergic medications, with a focus on those prescribed in outpatient settings. There are additional anticholinergic medications that aren't as frequently used or are specific to hospital settings, including certain nausea medications and treatments for more specialized conditions. Now, who should steer clear of anticholinergics? These medications are indeed quite common, but should everyone avoid them? I believe there are 3 specific groups who should be particularly cautious about using anticholinergics. First, individuals concerned about their memory or cognitive function should actively minimize their use of anticholinergics, especially if they've noticed symptoms like memory loss or cognitive issues. Secondly, those diagnosed with cognitive conditions such as mild cognitive impairment or Alzheimer's disease should be especially careful. These individuals often have underlying brain changes, making their brain cells more vulnerable. Since Alzheimer's gradually impacts brain function, it's crucial for these patients to optimize their brain health by avoiding anticholinergics when possible. Third, anyone who wants to lower their risk of developing Alzheimer's or similar conditions in the future should also be cautious. If you're worried about the long-term effects of anticholinergics, know that the risks seem to correlate with the cumulative use, referring to both the duration and the dosage. If you've only taken these medications occasionally, there's generally not much to stress about. However, if you find yourself using them regularly, consider what steps you can take now to reduce your reliance on them. So what if you've been taking an anticholinergic medication? If it's just been an occasional use, there's typically no cause for alarm, but if you've been using it more regularly, the best practice is to evaluate whether it's possible to stop using it, switch to a safer alternative, or at least lower the dose to the minimum effective level. For over-the-counter anticholinergics, you can usually discontinue them on your own. However, if the medication has been prescribed, it's essential not to stop or cut back without consulting a healthcare provider first. Instead, I strongly encourage you to discuss your concerns with your doctor or even a pharmacist. They can help you explore alternatives and ways to reduce your use of the medication. Doing a bit of research beforehand can also be helpful. Think about what symptom or issue this anticholinergic was prescribed for, and then look up other options for managing that condition. For example, there are often non-drug methods or alternatives that don't involve anticholinergics to handle urinary issues, pain, or allergies. Doing some research before visiting your healthcare provider can help ensure you explore all available options, especially the safer ones, during your conversation. However, there are instances where managing a specific symptom or condition without an anticholinergic might not be straightforward or even possible. If you find yourself in such a situation and realize that you may need to regularly use an anticholinergic, try not to stress too much about it. It's acceptable to continue with a medication that has some risks if the benefits are likely to outweigh those risks, and if you've already looked into alternatives that didn't work out. Additionally, there are various strategies to help maintain your cognitive health and support your brain's function. Ideally, you might not need to rely on anticholinergics, but if it comes down to that, there's no need to be overly concerned. Just focus on seeking other ways to keep yourself healthy. Now that you're aware of the 7 common types of anticholinergic medications to watch for and try to minimize, this research is shared with you for information purposes only, and it is vital that you discuss your options with a medical specialist. I stress that your own situation is unique to you. Do not act on this information without firstly discussing this with your doctor. Thank you for joining us today. Please leave a comment below and share one thing you learned today and how you plan to use it. Your input is important to us, so don't hesitate to share them. Reading your comments gives us motivation and encouragement to keep producing high-quality content and meaningful videos. Please like, subscribe, and share.